left New York, and then out of the blue, Universal Music Group called me. And they were interested in me coming back to New York and like working with them. I had been using for a few years, and it got to the point where I was like living with this guy that was essentially like my dealer. I was like sleeping on the floor in this living room. Universal Music Group saw my work. They believed in me. So to have someone like put their trust back into me, it felt amazing. Unfortunately, the drug use came back. I had like this really big, nice office that I was like using in the office like daily. I would like come in early, close my door, and like had like all types of like air fresheners and things like that. And so I think after a while, people like caught on. Like there was people that had like put their trust into me, and then having them being like, just talking about like just how disappointed they were. The fact that they sought me out and brought me back in, it stung. I think I ended up using even like harder after I left the job because I just felt so ashamed. So that was really difficult. I felt like I betrayed their trust.
One of the things I've noticed is that a lot of men in recovery from Chemsex find it very, very frustrating that despite all their hard work and efforts to work a program of integrity, that the people around them continue to lack trust, putting their heart into recovery and having people continue to be suspicious or not really have faith. So to talk about that, I really want to talk to my friend Brando, who is in early recovery and I think who has a lot of great perspective. So Brando, welcome. Good to see you again.
Thanks for having me.
So diving right in, Brando, when you first stopped using, what were your expectations in terms of people trusting you again? Did you expect them to trust you quickly?
I have a weird relationship with trust. Like I feel like it can be dangerous.
It's vulnerable.
At the beginning of my recovery, I had burned enough bridges where I wasn't expecting trust or forgiveness. It wasn't until I had like more sober time under my belt, I started feeling better about myself, more confident that I wanted to pursue those relationships. And then the issue of trust came in. But like at the beginning, I didn't even think that I was worthy of it.
And when you talk about those relationships, what would you say were the hardest ones to repair when you think about families or friends or your partner or people at work? What that look like?
It's a toss-up. The thing what makes your friendships hardest is that like people can take you or leave you. Like family, there's almost an obligation to like keep going and like try to rebuild that relationship. But with friends, there isn't that. So it's much easier for those people to like detach, like you mess up or you do too much damage and then they're gone. Friendships are harder to keep.
Interesting. Probably the ones that you really count on, even more so than family sometimes in recovery, those friendships, the support system.
Some of those friendships felt like family. So this area where there would be a little bit more grace and more forgiveness, but like there are limitations in friendships.
And I imagine that must have been difficult for you, right?
It built a lot of resentment for like my sober friends. God, I've been doing this for so long. Like, can you please just treat me like Brandon, like the way you used to treat me?
This surprises a lot of families. Family often carries obligation. Friends usually don't. Friendship is voluntary, and once enough trust has been damaged, people sometimes simply move on with their lives. And that can create a second layer of grief in recovery. In Chemsex especially, where someone's social life, intimacy, sexuality, and in friendships may have become deeply intertwined. Rebuilding a healthy social network can take considerably longer than people expect.
So were there times when those people's suspicions about you or the questioning of you made you question if recovery was even worth it?
Yes. So what it did is it infantilized me. Like the way people spoke to me, like at the beginning when I first came out and I told them, I thought that the reaction was going to be like, oh, thank you so much for telling us. And what it ended up turning into was like people treating you with like kid gloves, like for better or for worse, like talking down to you. I just felt like I was like spoken to as a child. There's this really good song called Good News. And the chorus is good news is all they want to hear. And that it really felt like that, where I felt like I had to like perform. If I showed up, I had to have like a good report card. It wasn't necessarily about trust personally. It was more so respect.
Families are usually acting from fear rather than disrespect. They've often spent months or years living through crises, broken promises, and uncertainty. So when recovery begins, every conversation becomes a wellness check. Every phone call becomes an assessment. They aren't necessarily trying to control the recovering person. They're trying to protect themselves from being blindsided again. The challenge is that this very understandable anxiety can unintentionally prevent the recovering person from feeling respected as an adult who's trying to rebuild their life.
Were there things that you wish your family or your friends had understood about recovery that they didn't get in those early days?
Yeah, just how difficult it was. Like, even if you want to stop, just how difficult it is. I remember speaking to like my stepfather, and I had relapsed, and he was like, "Oh," and it felt like it was the end of the world for him, almost like akin to be like just giving up completely in his eyes. And I saw my relapse because I'd been in recovery long enough. Just like, okay, I relapsed. I need to get back on the ball and like keep moving. So in my head, I was already like, I've moved past it.
Yeah.
But like to my father, that wasn't the case. He just was like, all right, so is this over now? And I'm like, no, it's not over. There's going to be more relapses in the future. I would hope that there wouldn't be, but you have to expect that there will be. And I really wish he would have known that relapse can be a natural part of the recovery process.
Yeah. I think we can safely say it is, at least with meth. It goes with the territory, for sure.
Notice that Brando doesn't describe relapse as proof that recovery failed. He describes it as information. That's actually a very important psychological distinction. Families often experience relapse as catastrophe because they're emotionally exhausted. Clinicians tend to ask a different question. What did we learn? What vulnerabilities showed up? What supports were missing? What needs to change next time? That shift from judgment to curiosity is often where long-term recovery begins to strengthen.
If you could go back and talk to yourself in those first few months of recovery, what advice would you give to you?
I would tell myself that seeking like outside approval is literally what led to the drug usage in the first place. Like I used to soothe whatever stress or anxiety that I was going through. And so even with like trust, realize that you're going outside of yourself and you have no control over the other person.
No.
And so it's like futile for you to like stress about it or like worry about it. I had to trust myself, and I had to like believe in me and be okay with me and give myself grace.
Absolutely. So true.
One of the things I appreciated most about this conversation was where Brando ended up. External trust is important, yet lasting recovery often depends on developing internal trust. Can I believe my own judgment today? Can I tolerate disappointment without escaping it? Can I keep promises to myself? Those questions are usually far more predictive of long-term recovery than whether everyone else has forgiven you. Sometimes the most meaningful moments happen when people hear themselves say something they've known all along, but have never said out loud.
Well, listen, I really appreciate the vulnerability you had in this conversation today. These are not easy things to talk about, but I really believe that your experience and your wisdom here is going to really help a lot of people. So I thank you so much for just being so honest. It's been great speaking with you.